All right, 10:02. Definitely want to get started because we've got a great conversation ahead and we want to level set. Good morning, everyone. I'm Christina Passioni-Sayas. I serve as the Senior Policy Advisor for Erikson Institute, as well as I serve in the Illinois State Senate, representing the 20th District on the northwest side of Chicago. I'm really excited to be having this conversation today. And before we get into it, I kind of want to explain a little bit about our background of the report. We're going to kind of go through some tools and how you can utilize them. And we're going to have some key takeaways that we walk through with you. But ultimately, this webinar is meant to pique your interest. We want you to interact with the website that we're going to walk through. We want you to download the report. We want you to request one of these things here. We just got them fresh off the press, and so we definitely are interested in your questions and also your ideas and thoughts and uses of this particular report. So we'll be looking for that throughout the presentation. So I want to also invite you to ask questions throughout in the chat box so that we can try to organically integrate responses throughout the presentation. As you can see with this particular iteration of the Illinois Risk and Reach report, there's a nice little asterisk next to that year, 2019. This is the pre-pandemic view of our state's early childhood landscape. This is essentially the highest quality data we can get, or most complete data that we can get to be able to kind of continue to build on this multifaceted sort of holistic view of child development here in Illinois. And I'd like us to go to the next slide so that I can acknowledge that, this particular project is a collaborative project. I want to acknowledge our partners who lent their expertise to this report. The University of Illinois Early Childhood Asset Map. This is a group that's situated in the Urbana-Champaign campus and works really closely with us on this report because they kind of are the holders of the universe of early childhood data and have been just tremendous in being able to help us flesh this out a little bit further. And then the Fiscal Policy Center from Voices for Illinois Children, which is now a part of the YWCA Metropolitan Chicago. I want to also acknowledge our funders who generously invested in this project and its sustainability. And of course, that's the Irving Harris Foundation, which was the convener, the Pritzker Children's Initiative, an anonymous donor, as well as the Governor's Office of Early Childhood Development through the Preschool Development Grant Birth Through 5. I also want to acknowledge too, in terms of the collaboration piece, the illustrious advisory council of 40+ stakeholders representing public and private sectors across the state. They provided feedback for us to ensure that the report would be relevant, it would be timely, it would be accessible to those who digest it, but ultimately that it is curated in a format in a platform so that we can ultimately make these data actionable. Let's go to the next slide. All right, so some of you all may already kind of be familiar with the purpose of the Risk and Reach report, but just to level set, I'd like to provide some context. We produce this report every 2 years, and it is a curated data set that provides a comprehensive snapshot of child well-being. There are 34 data points, 15 risk indicators that are factors that can undermine child development, and 19 reach indicators that reflect the participation and or eligibility data for publicly funded early childhood programs. It does not include local investments. It is state and federal investments only. The first report was released 2 years ago, and it featured mostly 2016 data. And keep in mind that fiscal year 2016, the context to kind of keep at the top of your head around this is that we were in the midst of a budget impasse. And so we were operating without a complete state budget that lasted through part of fiscal year 2018. So 2016 is starting to kind of show a little bit of that impact. But then, you know, the data that we're looking at right now is actually showing sort of the long-term impact of that fiscal impasse. The second edition features data mostly from 2019, post the budget impasse, right? And as I mentioned, it was the most recent data that was available at the time of production, and it allows us to kind of get this baseline pre-pandemic view. And as I mentioned, there's greater confidence in the quality because it was collected prior to the pandemic, and we know there's been a significant amount of disruption as a result of this pandemic. And so we wanted to, you know, have some confidence in the data that we were sharing. So let's move to the next slide, because I'm really excited to announce that in addition to the report, we now have the fiscal scan, which shows state level early childhood investments from fiscal year 18 through fiscal year 21. And this is where you're going to be able to see participation rates, investment rates over time, the trends, so on and so forth. And then the interactive website, and now it houses data from the 2016 report and the 2019 report. And I'm going to walk you through some of the really cool features on the site just a little bit later. But this is going to be your access point to the report. So moving on to the next slide, the data in this report can inform policy and program funding decisions made by local and state governmental and non-governmental stakeholders who can facilitate greater equity for Illinois' young children and their families. It's essentially designed to evaluate how well are we reaching children, help communities better understand early childhood programming gaps and needs, and inform decisions regarding policy, practice, and funding affected by early childhood. When you registered for this event, we asked, how are you using the data? And the top 3 ways that this audience, you all, used the report was to inform your advocacy efforts, to inform organizational priorities, and to form cross-sector collaboration partnerships to tackle an issue, something that we know is incredibly important, as it was definitely emphasized during the pandemic. But as we look ahead and hopefully are turning the corner on the pandemic and looking at now this early childhood transformation work, the coordination and alignment work is going to be paramount as our system transitions from the disparate, fragmented system that it currently is to something that is more cohesive and comprehensive and coordinated. So let's go to the next slide here. And I apologize if this makes you a little anxious because there's a lot going on here. It's very complicated. You know how they ask that question on Facebook, what's your relationship status? And you answer, it's complicated. Well, this report is complicated. Data for the recently released report in 2019, and it mostly reflects children 0 to age 5. And it's presented in the form of tables and maps. And it can be incredibly overwhelming as this image is. So a few things to kind of keep in mind to focus in on how to make meaning and how it can inform action. The first is that the maps are meant to support or serve as a visual cue that prompts you to go a little bit deeper into the actual numbers. Sometimes we like to, zoom out and see that bird's eye, but then really what this report is helping you do is figure out, okay, given the bird's eye, I want to look at where I live or where I serve or a region that I care about and better understand it. So that's number one, so visual cue. The second piece is that data is also categorized from low to high risk or low to high reach. But again, this is just a cue for you to look at the actual numbers within the tables to start to discern what is happening within your county or your legislative district. And I'm going to get into that momentarily. And then 3, you're going to want to compare the data from the first report to this current report. That's sort of like a natural instinct to be like, oh, how are we doing better? Are we doing worse? So on and so forth. But it's really important to note that county data is calculated in relationship to how it compares to all other counties for that specific year. So it's not a complete apples to apples comparison. And therefore, when comparing one year with another, it doesn't account for shifts in population, such as like decreased birth rates, as well as program changes such as eligibility requirements or decreases in funding. So got to keep all that kind of in your brain as you're looking at these data. As I mentioned before, today's agenda is going to kind of go through some of the key observations that we've made in looking at this report, how to use these tools in an applied way, and then a conversation with the illustrious Dr. Jamila Jordan, the Executive Director of the Governor's Office of Early Childhood Development. So I want to just kind of give you a nice sort of visual of these key takeaways, right? Because essentially they can illuminate for us within the state. What are the strengths in the state? What are we doing really well? What are the trends over time? And then what are the opportunities that we have to build upon what we're working on here in the state with respect to early care and education? So now I want to give you a little bit of context in this next slide. As I mentioned, we're talking about the 0 to 5 population, but let's look at the entire state of Illinois. According to the ACS, 2019 data, we are at 12.6 million individuals who are living within the state of Illinois. And as you can see here, we've got it kind of blocked out based on our racial and ethnic demographics. And if you go to the next slide, you can now see how that shifts when we're looking at the 0 to 5 population. Zooming in on that. And actually, one thing I want to note about this report, we were able to break out, you may recall in the last report, we had that not so exciting category called other, where we smushed a whole bunch of different racial and ethnic groups within there that we could not disaggregate. And now this year we're able to break out a little bit further. So as you see now, the children under age 5 by race and ethnicity, we have about 916,880. And so I want to just, kind of call out that you see there's a slight differentiation in terms of the demographic breakout within this particular group. It reveals a greater diversity in our young child population. And what you see here is that we have Asian at 4.74%, Black or African American at 14.8%, Latinx or Hispanic at 24.13%, and white at 51.3%, and other non-Hispanic at 5.03%. And I want to just note here too that child population estimates vary. The U.S. Census reports that children under the age of 5 tend to be undercounted. We know this in the field. And there are different methodologies for estimating child population total, and they produce slight kind of variances in estimates when comparing to other sources of population data. So now that we see what the racial and ethnographic breakdown is for our children under 5, let's go see where they're concentrated across the state. And I'm going to also give you a little bit of an orientation here about how our maps work. So what you see in the upper right corner is the title. This is our child population, number of children age 5 and under per the ACS 2019. You'll notice that the map is kind of shaded in various shades of the Erikson blue. And the darker the blue reflects the deeper the concentration of whatever the indicator is that we're looking at. In this case, it's the number of children within each county. You'll see each county is represented, our 102 counties. And then on the left side there, you'll see there is a little legend for what each color variation represents, the range, in this case, of the number of children in a various county. So this map shows that, we have this distribution across the state, but essentially those 916, 888, or 880 children make up 7.24% of the 12.6 million residents here in Illinois. I want to note that we've seen a slight decrease in the child population under the age of 5. In 2016, we reported 945,752. And in general, our state has been experiencing a population decrease, which also includes the population under 5. And there's, several reasons for this. People leaving the state entirely. There's a downward trend in the state's birth rate, and possibly, what we mentioned before, the undercount of children 0 to 5. So let's go on to these key takeaways now that I've kind of oriented you to who we're talking about. So when we look at poverty, for example, this is the federal poverty line, 100% of the federal poverty line. In general, when we're looking at the change from 2019 to 2016, there was a slight decrease in the state rate for poverty. But the percent of Black and Latinx children experiencing poverty, while there's a decrease in their respective percentage points, they still experience poverty at a higher rate than other children. So let's look at the other slide so you can kind of see that. It shows here, as you can see, the maps show the distribution of the concentration of poverty of children under 5. As you can see, the state rate shows it went from the 21.5% to the 18.79%. But then when we look at the breakdown here, you still see a change in terms of the impact for Black and Latinx children. But when you see the distribution or the experience across the racial and ethnic categories, it's radically different. You see that in the case of 2016, you see Black children were experiencing poverty at almost 1 in every 2. And then there was a slight decrease in 2019 to 42%, but we know that is a significant chunk of the population. So again, it helps us start to think about things in terms of a targeted approach and how we support families and their ability to be self-determined and access to resources and so on and so forth. So let's move on to the next slide in terms of these key takeaways. So we've got maltreatment here. This is the rate of reported abuse and neglect to the Department of Children and Family Services. There was an increase from 2016. In conjunction with this increase, the percent of children age 5 and under in substitute care attaining permanent homes within 12 months slightly decreased by 1.9% in 2019. Something to consider as you're looking at this data, there could have been an increase in reporting, either by families or the Department of Children and Family Services. It could be a reflection of the budget impasse and the erosion of the safety net that families may have relied on. These are all questions that I think need to kind of be unpacked and discussed at the local level within our counties. And within our local jurisdictions. But those are some considerations. Looking at the breakdown actually in the next slide, you can see too, these are the variations in how it looks on the map. And again, look at that, experience for children by race and ethnicity. you see the staggering disparities when we disaggregate by race. Something I want to also kind of highlight here in this risk and reach report, which is like super critical. And when we're talking about risk, I want everyone to understand that the advisory council took a very firm position that when we discuss risk, it is not about inherent risk. No child is born with risk. No family is born with risk in them or community. Risk shows up in our environment in the form of barriers and challenges and systemic flaws that are presented to families and children as they are trying to access resources. So when we are talking about risk, we're talking about risk factors. We are not talking about any kind of inherent risk. And I really want to emphasize that because sometimes that phrase at risk slips off our tongue and we have a vision in our head about who we're talking about instead of thinking about how the system is creating these barriers and challenges for families being able to thrive. Let's go to the next slide here in terms of our key takeaways, food assistance, right? So we saw a slight jump in participation within the Supplemental Nutrition and Assistance Program. And, going to the next slide, you can kind of see how this is mapped out across the state. And this is, now what I want you to understand, this is a reach slide, right? So the base of this slide is actually the composite risk score that has been assigned to each county. Based on looking at the 15 risk indicators and adding them up and dividing them, looking at the rates of the 15 risk indicators for a given county and dividing it by 15 to get an overall risk score or category. Those yellow dots represent the reach of that public investment. In this case, it's the Supplemental Nutrition Assistance Program. And so, something that I want you all to kind of consider here is that while we had an increased participation, again, could be attributed to the fact that, with the SNAP benefits, that's actually federal dollars that we do appropriate via the state. We're able to, maybe because of the budget impasse, more families were accessing that resource. But we also have to think about what are the conditions that have been created that families have to access the resource and that we have that increase, right? And so, of course, we want families to have access to healthy food and nutritious supplements, but at the same time, what are the circumstances and conditions that are pushing people to have to be reliant on public assistance? So that's something to just consider in the conversation. Let's go to the next slide here, violence exposure. So this is the state rate of reported violent crimes per 100,000 people. So it has decreased from 2016. Something I really wanna also point out here, this is a universe data point. This is not just children 0 to 5. We don't track and know of the violent crimes reported if a child has been exposed to that violent crime or not. But we do know that when we have violence in our communities, that indirectly children feel the stress that family members, that caregivers may feel as a result of being in a community that is navigating a lot of violence. And so just wanted to make sure that you all had that understanding. Let's go to the next slide here. Because I think what's really interesting to kind of see in this particular slide is, there's a lot of assumptions about where violent crimes take place, right? Chicago, of course, is always in the headlines and Cook County is always in the headlines. But, you look at this particular slide and we see some deep, dark blues across the state. And what this does is it helps to kind of disrupt some assumptions that we have about where violent crimes take place and how we can all be thinking about addressing violence at the root cause. Looking at housing, looking at access to high quality healthcare, mental health, economic opportunity, high quality care and education. All of those things contribute to circumstances and conditions that either can leave people with no choice or put them on a different path. And so it's just one of those things that we have to consider. And we thought it was really important to lift up the exposure to violence, because we know that that is so prevalent in a lot of our communities. Let's go to the next slide. We're going to look at immunization here. And obviously this is going to be a hot topic, right? Because we do know that the announcement just came out that we could be having a vaccine for children 5 to 11 sometime between Halloween and Thanksgiving. We also, will I be talking more about the composite? Yes, we can definitely break that down a little bit further after I get through these takeaways. So the immunization piece, and also, we do know that there's currently data being collected for the COVID vaccine for children under 5. But this might be an interesting proxy for us to look at, right? Because this is the state rate of children between 19 and 35 months who completed that combined the recommended 7 vaccine series. So we had an increase over time over the past few years. And so let's look at the next slide so that we can also see the breakdown. And you can also see drivers, right? In terms of who's driving the change. Look at the 2016 versus the 2019 rate. And also this can also help us look at where are we struggling to get participation and compliance with these vaccine series, and where might we need to deploy additional resources to support families' hesitancy around vaccines. And it's also not to dismiss, let's be real about this, right? In so many ways, one, I want to just put the PSA out there. We need to not shame people. We need to support people in helping them have accurate and relevant information for the decisions that they need to make for their families. And the reality is that historically, we've had a lot of mistrust and frankly, abuse within the Black and Brown communities with respect to how the medical sector has treated us. And so, of course, there's going to be hesitancy, but we have to do our job to support and do that kind of each one, reach one type of tactic. We know that peer recruitment does work in helping people understand what the assets are and what the potential risks are. But anyways, point is that if you look at the immunization rates and the changes and shifts, you can see that across the board, racially and ethnically, we had an increase. And you can kind of also look at how certain groups have driven the change over time. So just wanted to kind of point that out. Let's go to the next key takeaway slide, mental health. So this is the state rate of children 0 to 5 receiving mental health services through the All Kids program. So understand that this is like a slice of a universe, right? This isn't all children 0 to 5. These are the children 0 to 5 who are eligible for All Kids and who have received some type of diagnosis and now are pursuing mental health interventions, right? So like understand it's, but we thought it was important here to kind of highlight this because, we know that there is likely going to be an uptick in all of this as a result of the pandemic. And definitely have to commend the Governor's Office of Early Childhood Development for doubling down on the expansion of infant early childhood mental health consultation and that model, ensuring the cultural congruence, the linguistically responsive approaches to this, because that seriously makes a difference. I can tell you, I've got an amazing mental health clinic here in district that does everything from cradle to grave, and they do it in such creative ways. Everything from theatrical storytelling for folks who are undocumented to find their voice, to the traditional methods of child-parent psychotherapy and clinical interventions for young people. I mean, there's a range. So I'm saying that type of approach matters. But point is that, I want to highlight, because this year, while we were In the legislative session, Governor Pritzker established an Infant Early Childhood Mental Health Consultations Act, and that is going to set the stage for increasing availability of services and improving the communication of materials or explanation of services to families and providers, and really to round out our data collection system around early childhood expulsions. And, you know, there is now a full-time position in the Governor's Office of Early Childhood Development that has a coordinator who I'm incredibly proud of. Had to do a shout out to Erikson because she was an Illinois Early Childhood Fellow. And so she's going to help to guide the expansion and also create a database or a registry for mental health consultants to support staff and adults so that we can have a better grasp on how our resources are being reached. So want to go into this next slide here so you can kind of see where the, where the range of mental health services are. What is her name? That is Christine Bramblia. I know she's, I don't know if she's on here, but, shout out to Christine. So make sure you all get in contact with her if you want anything about infant early childhood mental health. So as you can see here, like, look at what we have to, Christine Bramblia. I hope I'm pronouncing that right. I know my name gets butchered quite a bit, so apologies on that. I know you as Christine Nickman, but things have changed over the past few years. And also Dr. Jordan, do you want to correct me?
Brambilla.
Awesome.
Christine Brambilla.
Thank you. Okay, so there we go. Thanks, Edna. So the mental health services, as you can see, look at the difference between 2018 and 2019, just 1 year in the state rate, even though we had a slight decrease. Look at how the distribution has changed in terms of Western Illinois and Southern Illinois, right? What these maps are supposed to do, as I mentioned, that visual cue, let's go deeper, right? Or let's zoom out and say, what was happening in Western and Southern Illinois where they're getting a greater range of reach compared to other parts of the state? And let's also just be real here. It's only 5%, right? Like it's not like an exuberant amount of individuals accessing these resources. So we've got to do some work, and that's why I really commend you for doubling down on this and prioritizing, because it's precisely data like this that helps us understand how we may need to refocus and be targeted, so on and so forth. Okay, now going on to developmental screening. Whew, this is an interesting one. So we're happy to see that there has been a significant increase in the administration of developmental screenings across our state. You can see it jumped from 96,000 to 109,000. However, I want to point out here, this is a map, and let's go to the next map. This is really a data point about reporting. It is not required that we submit to a centralized location all of the developmental screenings that are happening across the state. So it's really important to understand that while we see an increase here, it could be attributed to reporting. But the point is that we want to create some more awareness about this. And, I might just have a legislative agenda that I need to carry out with getting these developmental screenings reported more frequently. But what's more important is people getting services, right? This is just the first step. It's one thing to get screened. It's a whole nother thing for that screening to then result into an assessment, to then result into a referral, to then result into the provision of services, right? This is just the first step. So we've got some work to do here, but we also want to, call that out, because you can also see, generally speaking, where they're happening more frequently and how we might be able to learn from that. Because looking at these 2019 numbers, I'm looking at, right here, Iroquois County, seems like they're doing quite a bit of developmental screenings. Okay, so let's go to that next slide. Publicly funded preschool. So we are making progress towards closing this gap, right? In 2019, the gap was 11,439 slots compared to 30,466 slots. And so this is the gap between the available slots and the number of children ages 3 and 4 who are eligible for the preschool program. So again, this is another important data point to have some conversations with at the local level. Because if we look at the next slide here, you know, we want to think about, you know, one, there are some differences in how we captured and reported this in 2016, but there also were some eligibility requirement changes. And so we may, you know, that might be attributed to it. And I think it's important that we acknowledge that. So those are the key takeaways. You know, again, inviting you to go a little bit deeper, and I'm actually going to show you how we can go deeper. So let's take a ride on the very exciting website. And I am going to share my screen here. Make sure I've got some screen sharing patterns. Okay. And thank you, Brian, for explaining the whole breakdown of how we did the composite score. All right, everybody can see my screen, thumbs up. Okay, let's go here. So here's where you're gonna come to. This is your riskandreach.erikson.edu. And this is your landing page in case if you need a little explainer, nice little 2-minute video, break it down real quick. A little reminder here about how we can use these data to inform action, right? And then I just want to give a little plug here. If you haven't downloaded the report, you can get it right here. What's beautiful about the process is as soon as you fill this out, the links automatically show up. You don't have to wait for it to show up in your email. You can get access to it right now. You have, as I mentioned before, the 2016 and 2019 reports, both the risk and reach and the fiscal scan. So you have that at your fingertips. So, you know, just know that that is available. I want to, you know, also take us to, let's go to these interactive maps. So what you're going to see here, a little bit of breakdown, we all know, in terms of what the interactive maps show. And we also have, it's broken down by domain, right? We have the 3 domains here. So you see family stability, health, early care, and education. Data is available by county, and some data is available by legislative districts, okay? Not all of it. You want to, you know, like, let's do an example here. Oh, well, let me just kind of also, right now we're looking at overall risk. So this is that composite map, right? And so you want to, over here in the read more section, it's going to give you the breakdown. And it's essentially giving you a breakdown of what Brian had explained in the chat and how we came up with the overall risk score, so on and so forth. And then if you have even like more questions, the tools and FAQ section is gonna, you know, try to do what it can to respond to your questions. We will say living document. So if you have questions that you feel are not reflected here, please do not hesitate to send a note so that we can add that and help to explain a little bit better. So if you want to, you know, kind of see a particular county, you know, since I'm operating out of Cook, you can kind of see what the overall risk is in terms of Cook County, and the high, in this case, it's high moderate. Other counties have high, some have the low. So, you know, same thing with the shading and gradation, right? So I do, Sylvia, that is an excellent question. So right now, we do not have the breakdown by race, ethnicity beyond the state. There's some data points that have it available, but that is definitely a goal. I want to say that the cloud data project for Chicago should have that information. And I think Dr. Jordan can talk when we have our convo about the, the pieces with respect to the Illinois longitudinal data set and if there are elements available. And also ICAM, feel free to weigh in here. I also want to show you all too, in terms of down here, every single map is going to have a table. And you can play all kinds of ways with this table, right? We can type in a county, right? We can see what it shows with respect to the breakdown. The overall risk level is high. I can delete this and, I can sort by overall risk level. We can sort by the geography, so on and so forth. So you can play with these tables. The point is for you to, be interactive. So I'm going to just show you really quickly how we can kind of play with a couple different, what's great about the interactive map versus, this report is beautiful, but when we look at the static maps on the report, particularly the reach ones, all base maps are the overall risk score, whereas on here, we can mix and match what the base is with the overlay. So that's where you kind of get some interesting stuff. So we are going to look right now at, I'm going to give you just a quick example, 200% of poverty, right? On the risk side. So that's what my base is, right? It's going to show me what the 200% of poverty. And if I look at I hover over the county, I see what the actual county percentage is. So in McDonough, it's 47.12%. In comparison to Illinois, Illinois is 38.66%. And then it gives you the raw number for each of those. And then it also gives you what the risk level is, right? High, moderate. Again, I'm going to look at this in relationship to the child care subsidy, because right now we know that the child care subsidy has a threshold, an economic threshold of 200% federal poverty. Now, super excited because that is codified in law. So now we see the reach, right? And we see how that kind of plays out by our state and by county, right? And so it provokes us to ask some questions like, what stands out in this map? Does the data present a regional or pocketed problem? Can, models used in counties that are reaching more children be replicated in nearby counties? Like, I'm just wondering here in Champaign County, you look at Champaign County compared to, it's technically has high reach, right? And then right next to it in Ford County, we've got low moderate reach. So something to note, the reach, the yellow dots, the larger the dot indicates, the greater the reach. And so it's kind of reversed with the risk, where the darker the color indicates a higher concentration of that particular risk factor. Okay. Let's move on then to, and the other thing I think that's important to note is that people don't always live and work within the boundaries of just one county. They cross boundaries. So that's another piece to kind of consider. You might live in one county, but you may drop off a kid in childcare in another county. So we need to also think about how that plays contextually. Okay, let me see here. There's a comment. You say the data points inform action. They're of course not worth anything without action following. So what is an example of action following a data discovery? You will find that mental health crisis has increased, staggering levels. When you look at it, too late for now, but the action is needed now. How are you responding to what is urgent and critical now? Excellent question. We're going to get into a couple of those examples in the next slides after I finish walking you through this. So this is just one example to show you, how you can play with the data, right? And then, from the vantage point, I just want to show real quick, let's look at this in terms of how this plays out with a legislative map. And of course, for me, I'm looking at the one, and yes, Chelsea, when you see a larger circle in the darker counties to indicate the reach is closer to meeting the demand. That's if the base of the map, so in this case, what we were just looking at was the 200% threshold, how many families are earning, at the 200% federal poverty line, which is like a little under 50,000 for a family of 4. And what the reach is within that county for CCAP, which we know the economic eligibility threshold is 200%. So yes, you are correct in understanding that. And so do we know if the ECE regional areas will correspond and or include whole counties so that the counties can be aggregated from this data? So Sylvia, I think you're talking about those regional hubs, and that'll be a great question for Dr. Jordan to speak to the extent. Oh, thank you, Ryan. Catching up on these as they're coming in. Okay, so let me just show you really quickly, one of the pieces. So I'm looking here. I'm gonna zoom in just a little bit more so that I can get to the district I represent. So Senate District 20, right? So looking at, 43.51% of the families who live within the district I represent are living at the 200% federal poverty level or below. This is higher than the state. It translates to about 6,800 families. But then when I'm looking at, okay, how many are accessing the child care subsidy? And now I see only 23% of families eligible are accessing CCAP. So it makes me ask some questions, right? What's happening in my district? Is there an awareness campaign that needs to happen? Is there specific outreach that we need to tailor to families that speak languages other than English? Because if you visited the 20th district, we're like the United Nations over here. Just on the block of my district, I've got Jordan represented, I've got Palestine, I've got Ecuador, I've got Colombia, I've got Korea, I've got Japan. I walk in all these businesses and we are speaking all those languages. So point is like, how are we meeting those needs, right? But also, how are we addressing there might be some hesitancy of sending your child to, because you've got Tia that can take care of it, or Abuela, right? So how are we supporting folks in accessing that? And, the other question I'm asking, are there enough providers within the district that accept subsidies? So like making those connections, right? So Illinois Action for Children, I'm gonna be calling you so we can work this out district, because I'm not gonna let this happen in my district when I am the early childhood advocate. Okay, so moving along here, I know I wanna make sure that we have some time, and I wanna also address that fabulous question that came from the fabulous name Think Equal. I like that. Okay, so I'm gonna stop sharing. I'm gonna go back to the slide deck. We're gonna talk about what is happening now to address these particular issues. So let's go back to the slides, Luke. And while I'm going through these, Veronica, if you can drop in the chat the page where people can access, because what I neglected to show you all, we have one-pagers for each county where you can see in aggregate what's your county broken down, every single one. You can, do one example of a county one-pager and one for the Senate district. I look at this page and I'm like, oh yeah, we're gonna get some things done here. I'm actually trying to look for my one-pager that I have on my desk whenever I need to reference it. Okay, so back to some state highlights here that I wanna, just kind of put out. Now, Think Equal, things are not perfect, right? We've got some work to do, but I do think that we've made some elements of progress with respect to ensuring that we've got some constructs in place, right? So one of the things that we worked on this past legislative session is $200 million allocated towards early childhood professionals to pursue degrees and credentials. This was a bill that I introduced that specifically is looking to address the shortage issue that we have in early childhood. We know that early childhood professionals are woefully undercompensated and basically making poverty wages, and we need to do something about that. One way that we can tackle that is, of course, removing barriers for folks to obtain their educational goals, whether that be a credential, an associate's degree, or a bachelor's degree, or even a master's degree. But we're really trying to target that incumbent workforce that is currently struggling to make ends meet, and obviously we want to improve the quality of care by professional training, job embedded. Anyways, the point is that that's one investment there in the workforce. There's also an investment around hero bonuses for individuals who have been working through the pandemic, and there are $1,000. Granted, we'd like to definitely see more. We need to see sustainable funding to increase compensation and wages and benefit packages. But this is a beginning using some of the ARPA funds that came from the feds. And right now it's available to all staff and programs that are eligible for the child care restoration grants. Let's go to the next slide. And here, we are also trying to make childcare more accessible for families that have been experiencing unemployment or employment loss as a result of the pandemic. So now childcare can be subsidized for up to 3 months while parents are looking for work, because we know that one of the requirements for CCAP is to be able to demonstrate that you are working a certain amount of hours or enrolled in approved educational training program. And then we've got $300 million worth of restoration grants to keep our child care centers opened. And we know we now have the data that nearly 100% of those that were receiving grants were able to stay open as a result of the pandemic. Now let's move along to the other set of highlights here. If you could just bring up this next one. So the child care reimbursement rates increased by 3.5% to get closer to adequate funding levels. We know that's still a ways to go, but we are, or I'm sorry, it's 3 to 5%. And then we've got the healthcare and human services reform that specifically the Black Caucus had advanced, and there's a ton of amazing provisions around prenatal care and child and maternal health and doulas and home visiting being covered by Medicaid and group care all being rolled out through this. We, as I mentioned before, we now have codified the floor for the child care assistance program, because as you may recall, the with the budget impasse, one of the just dubious moves that was made by a previous administration was to reduce eligibility to the point that 90% of the families that were initially eligible for CCAP were no longer eligible. And we have been obviously spending a lot of time and effort and resources to get our rolls back up. So to the point in terms of connecting families, that regional hub model that is going to be rolling out through the early childhood transformation team is meant to work with folks on the ground, our community collaborations and collaboratives, so that we can have a ground up approach with connecting families to the supports and services that they need instead of a top down approach, because we know that everything is locally contextualized. We know that the wisdom is in the community and knowing how to make those matches, and therefore it's the state's role to build the capacity of these collective tables to address those needs and meet those needs. Let's move along here because, and then I think also too, to the point with the infant early childhood mental health, I definitely know that Dr. Jordan is gonna cover that a little bit more. So without further ado, I want to address or introduce our guest, Dr. Jordan. She is the Executive Director of the Governor's Office of Early Childhood Development here in Illinois, and she has over 30 years experience in the field of early care and education. She was interim dean of the College of Education and tenured professor at the Department of Early Childhood and Bilingual Education at Chicago State University. And she served as a Head Start Assistant Executive Director, Accreditation Project Director, interim Executive Director of the Chicago Metropolitan Association for the Education of Young People. And Dr. Jordan, it is truly my pleasure to welcome you and have this conversation.
Thank you. I know you're here in a dual role, so thank you very much, Senator Pacione-Zayas, as well as in your role as Senior Policy Analyst for Erikson Institute. I bring you greetings on behalf of the GOECD team. Also would like to acknowledge all of the partners who have made the work related to the Risk and Reach report possible. So thank you very much for the opportunity to join you for this conversation. I have my tea. I see you have juice, so we can have the conversation. Let's have the conversation.
So I think, you know, the first question I have also kind of ties into some of the questions that, you know, have been coming up within the chat here. And just, you know, really interested in you kind of reflecting and sharing how the data from the report has been the most useful for you to inform efforts to close the gaps and to equitably distribute resources through, you know, thinking about we still have the PDG birth to 5, you know, plan, as well as Raising Illinois, which is the, you know, formerly known as the PM3, the prenatal to 3 agenda. And those plans, you know, are obviously represent a culmination of work as well as a confluence of voices and ideas. And so, you know, I'm just trying to understand how you've taken these 3, you know, kind of pieces and helped them to guide your work in the office.
Yes, thank you for the question. And I actually have thought about Risk and Reach and just want to, in so many areas, but just want to highlight, you know, a few in our time to, you know, together. I wanted to start with and thank you so much, but, you know, as far as the phenomenal work that was done as part of the Risk and Reach report as it relates to race and ethnicity, you know, breakouts. This has been central to our work funded by the Preschool Development Grant Birth to 5, as we've been, I see Elliot Regenstein is on, who chairs the Data Research and Evaluation Committee, has been part of this effort. If there's others, you know, excuse me, I don't see you on the screen, but we've been, central to that work is really getting to, you know, the heart of race and ethnicity. It's really important, and as part of the longitudinal data system, the first use case on that platform is the child care participation data set. And our goal there is to have the opportunity to look across you know, a child's early learning experiences within the state by race and ethnicity. And so, you know, we're really wanting to have just a full picture of the supports and services that children are accessing, you know, within the state. I want us to be mindful. You know, I was watching the chat, and also, you know, thank you for, you know, the overview. again, just reminding, everyone that, this is data that's pre-pandemic. And so what we need to really be mindful of as we think about, risk factors is the cumulative effect of risk factors. And so as we think about, whether we're talking about family stability, whether we're talking about health or early childhood education, I just want to caution everyone about the importance of ensuring that we look at this in a holistic, from a holistic perspective, and especially as we look at race and ethnicity, as you have noted in your comments, that we pay attention to those children who are disproportionately represented and impacted by those factors, whether it's family instability, whether it's health, or their early learning experiences. And so I'd like to, propose that our use of the data is that we begin to think about 2 years out, what this data, because of the pandemic and other circumstances, as a baseline, to really be mindful of, those disparities that surface. Are they increasing or decreasing? As you spoke to, identifying those structural barriers that might be preventing, access to services and supports and interventions known as protective factors. What do we need to change? What do we need to add? What do we need to modify for, cultural or linguistic reasons that it's culturally appropriate? And so what I like to say is, let us not allow the risk and reach report to sort of serve as a desk. We oftentimes, and I know you heard me say this, there's so many reports and we kind of put them to the side. But what I want to ask as far as, the report and the information, how we use it in our programs or in our policy arena, that we use this as our go-to, reference, and not allow this resource to sit on a shelf, and use it as one of our strategies to actually strengthen our early childhood systems to ensure that it is equitable. As far as the other, point that I want to reference is the availability of early quality child care, and specifically, the preschool, information that you shared. It clearly speaks, to the fact that we're on the right track as far as, expanding availability and access to quality. But as noted, if we go forward and in our work, as we are starting to look or have been looking at our Accelerate system within the state, which is the state's quality early quality improvement system, if we overlay what we know about circles of quality that we use within our state, if we overlay that by county or however we're able to, overlay that data, would help to provide us with an opportunity to see where those quality, by circle of quality, where those programs are located. And in fact, are we reaching, children in certain communities, across our communities, across our counties, with high quality, educationally important services. And then finally, as it relates to, again, access, it will also help us, as I've looked at a couple of the maps, that we know within the state that we have some areas where we have oversaturation of early childhood programming. And then, of course, we realize that in certain parts of the state, we have, child care deserts. So one of the uses of this funding, as you know, the Early Childhood Construction Grant Program has not been offered for, 10 years. And so we're in the process of moving through that process to make that program available. And so it is our plan to use the risk and reach report and the data and the county data to look at, ranking, as we think about, facilities going forward as far as the early childhood construction grant program. And then finally, what I noted was the home visiting expansion. So it's great to see the increase in the number of families that have been able to access this service. I have to say, among many supports, that home visiting was a significant, safety net, during the pandemic. But what we also know is that enrollment is down across the state and across our system, including home visiting. And so as GOECD is serving as the convener, as it relates in relation to, I saw something come up in the chat, I'm sorry. As GOECD serves as a convener in partnership with INCRA and our other state partners, and state agency partners, this data will certainly be helpful to us as we're rolling out an enrollment campaign that will allow us to, outreach to, families, throughout the state as to address enrollment, which you did touch on. Of course, we're hearing there's concerns about re-engaging in our early childhood system out of, concern and hesitancy related to exposure, to COVID, as well as those individuals within our workforce that have assumed care for others. But again, for home visiting, the referrals were impacted. And so we need to do more work because we want to make sure that we, continue our reach as far as ensuring that home visiting is available, throughout the state and to all our children and families.
Great, thank you. Can you, speaking about the home visiting piece, who's the point of contact in your office now for home visiting?
In GOECD, that would be Deborah Wong, and that's HWANG, Deborah, DEBORAH, Deborah Wong.
And also just to kind of level set, there's been some kind of shifting of home visiting program, some of them to DHS, right, with MCV. Can you talk a little bit about that too, so that everybody is fully aware of that piece?
Yes, of course. So the MCV program was initially housed within the Governor's Office of Early Childhood Development. However, their funding was provided through the Department of Human Services. So in the last year, as part of our efforts to streamline and consolidate the home visiting program that was within the Governor's Office, MCV, was moved to the Department of Human Services.
Great.
But we still have in GOECD Deborah Wong, who is part of that team, who is our liaison, to make sure that we, are connected, to the home visiting team within DHS.
Great. And I actually want to just real quick show folks, because you brought up a really good point about high quality childcare. And, again, if I may give folks a little application here. So we're back on the interactive portion. I clicked on the early care and education. The base of the map is overall risk. The reach, those yellow dots, are looking at high quality childcare. And that is essentially, and also let me help kind of define how we are, or unpack what high quality childcare. So it's the number and percent of children age 0 to 12. In this case, we couldn't extrapolate the 0 to 5. So 0 to 12 receiving childcare subsidies who were in a gold circle of quality program in 2019. So what I want you all to see on this map is these little tiny dots means that there was no childcare program that achieved the gold quality. So you see across the state, we've got quite a few, right? But then we've got also some spaces where there's quite a bit. I mean, look at Kane County, where we have 37.9%, almost 38% of children 0 to 12 who have a CCAP voucher that are also enrolled in a gold quality program. So this again helps us to look and say, okay, what's happening here, for example, in Peoria County, where we have 13.47% of kids now in these gold centers, but right next door to it in Knox County, none. There's no gold quality program. So it helps us to be able to kind of target those resources. This is where those regional hubs that Dr. Jordan was talking about can also be supportive in building the capacity of providers to be able to meet not only the demand, but also the increased quality that all children should have access to. Okay, so I'll just stop sharing just because I wanted to give you all a case in point of where you can get that.
And so thank you for sharing. So again, make sure you revisit, as we think about our Accelerate system, and again, to ensure that our children are in fact, in high quality programming. We know that there's a significant number of programs that are not, part of our Accelerate, system. And so, again, it begs the question as far as what support those programs need to ensure that they are able to, participate in our quality rating and improvement system.
Definitely. There's a question in here. I'm just wondering perhaps if maybe even ICAM can weigh in. Are we going to be looking at sub-county data for childcare deserts for high density counties like Cook? And my instinct is that the regional hubs may be able to dive deeper into that, but I'll leave it to Dr. Jordan if you have any insight on that as well.
I don't. I would, really, if Dawn or Keith, I see Keith. I don't know, yeah, Keith, are you able to start and then I can talk about the regional and community councils, but if you would address the sub-county.
Yeah, no problem. And hi, everybody. I was just able to jump on because I was on a meeting talking about regional Office of Education and building a portal for them. Yes, so we do, for Chicago, we've done a lot of work at the CC. Oh, I need to stop that beeping 1 second. We do a lot of work at the CCA, the Chicago community area level. We also can do census tract or PUMA or township in the Chicago area. So we can get a deeper geography in a county like Cook. Cook, demographically, the data can get a little weird because when you look at like a county level, it's going to say one thing, but then everybody knows that Cook is gigantic and there's others of these deserts of different actual demographics. So yeah, we can do that. If you have any questions, please feel free to reach out to us. But we have done that work for the state and a few advocacy groups throughout the state.
So there's a question, can the Accelerate data on the map be broken down to silver? So I don't know, Christine, I mean, we certainly have that ability, but is that something you would want to consider going forward? I'm trying to keep up with the chat. Thank you so much for everyone, the questions. I've been watching the chat closely.
So that question came up during the process with our advisory council because we were thinking about including silver and gold on the map, and there was consensus that if the map is to sort of push us and motivate us to meet the greatest level of quality, we need it to be that kind of pointed and stark to show how big of a disparity we have across the state. So we made the conscious decision of actually not including it, but that could be included, like you could, and I won't sign ICAM up for additional work, but if I'm not mistaken, I believe they do have that information. And thank you, Keith, for always being a team player.
Yes, we
So
do have that
please-
data, and we'll happily do that.
Awesome. So you know how to get in touch with ICAM. And I mean, to Keith's point, I think what's really important for folks to understand with the risk and reach data set is like, it's a curated data set. It's a slice of what ICAM does on a regular basis, but it also includes data points that ICAM doesn't typically collect because it's outside of the discrete early care and education space, like the violence exposure, right? Like the housing pressure burden. That's why the report is kind of billed as a comprehensive snapshot of the environment, the circumstances and conditions that young children are living in. So just want to kind of help provide that distinction. But I'm happy to turn it back to you, Dr. Jordan, to talk about the regional and community councils, because I think what's really, exciting about that is, the organizer in me is always about the power of the people, right? And us coming together to, bring our vision in one space and coordinate and align it, and then, divvy up almost on a campaign level, right? What's the goal and how are we going to backward map and what tactics are we going to employ and how are we going to celebrate our wins along the way? And so I'm really excited for you to kind of unpack a little further this vision. And also if it was something that was already planned, or if it, especially because of COVID, you kind of like, redirected, because this is essentially coming out of the, the commission, the funding commission's recommendations. So you can just give us a little bit more background on that.
Yes, so we've actually, there's been a number of pilots that have been conducted over the years. And so this is, and when I say the years, over a decade. And so, as a result of those evaluations and those pilots and the evaluation, community, community systems, regional and community systems, definitely emerged as a viable infrastructure as far as engaging local communities in, decision making and, as beneficiary voice, as part of their community. In moving, the work forward, as you mentioned, it definitely was part of the funding commission, recommendations, and so it provided an opportunity for us to move forward with building, this infrastructure. So the data that is presented here, and especially there was a question about, the infrastructure and what the thoughts are. And so what is proposed at this time is to use the structure of the regional offices of education, as the, the structure for building out, those councils. That could change, but that is, the current, the current plan. Again, this data will be beneficial to your point as far as, community organizing. I kind of learned it at the kitchen table with my dad. And so, definitely to help communities with their own analysis of what, and prioritize, how they would like to, prioritize their needs and prioritize how they would like them addressed. And so I think, I know for sure that this data will be, valuable for that local planning. It will certainly be valuable to us in the state as we're rolling out the regional councils to, give increased understanding of those communities And so again, as I mentioned, earlier, let's keep risk and reach front and center, as a reference as we're rolling out, these different initiatives and strategies, statewide.
Great. I'm curious too. I mean, obviously, you just laid out a mammoth of a plan, but I think folks need to also understand and appreciate that this isn't the only thing you're doing. The regional hubs. There are so many pieces you all are working on, and just wondering if you can unpack that a little bit further. I'll give you a tidbit. I took a stakeholder Zoom meeting from a group, and they were like, can you break down for us what's happening in the early care and education space right now? I was like, how much time do you have?
Right. Exactly.
So,
I have to be honest with you is that I did a time check and I'm thinking, okay, so what can we talk about in,
right.
In the time that we have? Christina, I think I see Dr. Taylor's hand up. I don't know if she has a question for you or for me, I'm not sure.
Yes, good morning. Thank you, Dr. Jordan and Dr. Pacione-Zayas. I don't know if this is a question or a comment or a combination of both. So, I am a strong advocate for the risk and reach report for so many things. And I'm lately trying to get districts to really see the relevance of the risk and reach report. And they find it a little daunting because it is at the county level. And of course, with everything that's going on with districts now, they've got their hands full. But I just want to kind of put out there, and maybe one or both of you can speak to this. We can make a very strong case for the outreach that districts need to do in their communities, I believe, by looking at the risk and reach report. Not every child coming into a kindergarten or first grade at a district has had access to preschool for all or preschool for all expansion or even Head Start. And there is an impact on children that have not had these opportunities as they come into districts. So I believe the risk and reach report can help us do that so that districts can prepare for incoming students, prepare their staff, professional learning, lots and lots of things. But it is a bit of a struggle right now getting districts to not value the report because they value it, but they don't see, well, how does this impact me and my district because it's at the county level? And then of course, they're overwhelmed to try to dig in the data like we would to directly connect it. So is that something that either one of you can speak on?
I could definitely speak to that. So this is in our last few minutes, I'm going to show you all another little tip. So I just pulled up the legislative district, Senate, mine, that I represent, the one pager. So this is a tool that I think district administrators can utilize as they are meeting with their respective state legislators. And it helps to, one, what I loved about it, I was like so excited when I saw this, but what I love about it is that it helps us understand, one, the comparable, right, of 2016 to 2019, but then it kind of also breaks down in the early care and education, right? We do have some, obviously some gaps. You see where the asterisks are and the explanation that, some of the data is not available by legislative district. So, you've got some stuff there, but at least, like I can see right here in that last row of publicly funded preschool, right? I can look at 2016 and see that I had capacity in the 20th district for 2,655 spots. And there was a gap of 544 children not eligible or not able to get into those slots. You know, we had that need. So we had low moderate reach, meaning we didn't have enough reach to meet the demand. Now you see there's capacity for 2,129 slots, and there's 158 children that are not able to have their needs met. In comparison to 2016, that reach is greater, but also look at the starting points, the numbers. I mean, it makes me ask a lot of questions and get some accounting. And then, you know, of course, I'm gonna call my friends in CPS in Chicago Public Schools and say, okay, what's going on? I really need to understand this. And then, you know, I meet with principals and ask those questions. So this particular tool was designed to support these types of conversations so that, you know, because I could look at the county, you know, Cook County, and because it's a mammoth, I'm like, well, there's ain't me. You know, like, so this is meant to help you kind of drill down. And then I've got to do a shameless plug for Elliot's paper where, you know, he really kind of lays out the structural issues as to why K-12 districts struggle to make that connection with birth to 5. And Elliot, if you could, I know you have it somewhere, drop that in the chat so people have that gem. That would be great. So I hope that helped. And I don't know if you want to add anything else, Dr. Jordan.
No, I don't. Elliot has provided, you know, the resource. Thank you, Elliot.
Thank you so much for the opportunity.
All right. Thank you, Dr. Taylor. So just, you know, just quickly, I won't have the opportunity because I think we're scheduled to end at 11:30. So I want to be sure, you know, we end on time. But, you know, as Christine has noted, you know, our portfolio is really full at this time, you know, because of the preschool development grant, our learning renewal efforts, initiatives as part of our GEAR funding. But, you know, front and center is that we have launched our needs assessment and strategic planning, you know, process. And so, you know, want to use this opportunity to extend the invitation for you to join us in that work. A lot has been accomplished, you know, that was outlined as part of this discussion this morning. A lot has happened in this state, you know, and thank you so much for everyone, you know, just staying the course. A lot has happened within this state, even during the pandemic. And so we want to be sure that we capture, you know, the Funding Commission recommendations, you know, Raised in Illinois. You know, there's just a lot that has been done. So we want to be sure that our needs assessment and our strategic plan reflects that. As part of this process, we are also convening a data definition advisory team. So if we're having this conversation today, let's be mindful that we have not reached consensus across the state as to how we define key terms within our early childhood mixed delivery system. So this data definition advisory committee's charge is to help us reach some consensus, even as far as how we define age groups. We are not consistent. And so that is just one, you know, one task, you know, before us. As mentioned earlier, we're working on infant and early childhood mental health consultation. You know, again, thanking, you know, Senator Pasiones Zayas and her colleagues in the General Assembly for recognizing the importance of social emotional supports and supporting our efforts as it relates to infant and early childhood mental health consultation. As she mentioned earlier, our work is supporting that act that was part of the Black Caucus and their pillars. And so we're working within GOECD with leadership of Christine Brambilla to build out the infrastructure, you know, within the states to increase access to infant and early childhood mental health consultation services. We're also working within GOECD to streamline the professional development that is available to consultants. And then finally, we are building out a database by county area so that individuals can search by county for an early childhood mental health consultant. They can also search by language preferences as well as program needs and priorities. And then finally, and again, it's all, all roads lead back to Elliot. I don't know if Ben Boer is on, and, his team who's worked so closely with us with the PDGB-5 is the Longitudinal Data System 2.0 and the Child Care Participation Database. Again, addressing, legislation related to ensuring that we're able to address race and ethnicity as we provide services among our key states. There's more information related to that, but again, watching, our time. We're doing this in collaboration with our state agency partners, as well as the Illinois Head Start Association, and starting our collaboration with the Chicago Data Warehouse Project as well. So please watch for, those efforts. That's, just a quick, wrap up, but, do know there's a lot that's happening in this space. So Senator Pacione-Zayas, I take this opportunity to thank you, as well as the members, your colleagues within the General Assembly, for your leadership and service. We've come a long way, and Risk and Reach certainly tells us that there's more work, before us. And so, thank you for the invitation to join you today, and I hope we can have more conversations. So thank you.
Thank you. It's been great. I really appreciate all that you are managing gracefully.
Yes, thank you. Thank you for the flowers.
Yes. And, definitely want to thank everybody for tuning in. I put in the chat right now, if you have any questions or follow up, please email us at policy@erikson.edu. The Risk and Reach website is there. And I also put, because I want to just give a shout out, because I'm proud of this work as well with the Governor's Office of Early Childhood Development. We have a page on that website now that focuses on really explicating our commitment and strategies around fostering and lifting racial equity. So I think it's really important that folks are aware of that, because that is really a key driver in our work. And so thank you all for staying over for a few more minutes, and hope you have a beautiful weekend, and we will be in touch soon. Take care.